Welcome to this Win Club online module on Incontinence-Associated Dermatitis or IAD, which forms part of a series of modules you can access to develop your knowledge and understanding around wound management and skincare. Today, we will be discussing incontinence-associated dermatitis, which I will be referring to as IAD for the duration of the session. By the end of the module, you will be able to define and describe IAD and be able to discuss the treatment and management of IAD. Okay, let's focus on IAD. Now, IAD is defined as an erythema, an inflammation of the skin caused by prolonged contact with the skin of urine and feces. It typically presents as an inflammation of the skin surface, characterized by redness and, in some cases, swelling and blister formation. So, who is at risk of developing IAD? Now, in short, any patient who suffers from incontinence is at risk of developing IAD, so including patients with urinary, fecal, and double incontinence. There are also a number of risk factors which can put a patient at risk of developing incontinence and therefore making them at risk of IAD, including poor skin condition, compromised mobility, and side effects from medications. Now, a continence assessment will help determine the problem and what treatment is required. Therefore, it is important to establish a comprehensive baseline continence assessment, as its outcome will inform correct diagnosis and treatment. Many organizations have developed their own unique assessment criteria, so please check with your local guidelines. However, on your screen now are some of the risk factors for IAD that you must consider. I'll give you a few seconds to have a look. As discussed earlier, IAD is caused by prolonged contact with the skin of urine or feces. Let me explain this in more detail. Now, when the skin is exposed to urine for a prolonged period, bacteria convert the urea found in urine into ammonia, which is an alkaline substance, which increases the skin pH, rendering the skin more vulnerable to colonization with bacteria and secondary infection. Now, in addition to this, the digestive enzymes contained in feces are reactivated in an alkaline environment, therefore damaging the skin's natural protection, which is the acid mantle. A damaged acid mantle means fluid from urine and feces are drawn into the superficial layer of the skin, causing its cells to swell as they become overhydrated and subsequently disrupting its structure, thereby causing erythema, inflammation, sometimes skin erosion, which are a typical characteristic of an IAD. The skin exposure to a combination of urine and feces, the combined effects of these processes can significantly increase the risk of IAD development compared with exposure to either urine and feces in isolation. Let us now look at some specific characteristics of IAD. Now, normally, IAD appears as diffuse area of erythema, scaling of the skin, blister formation may also occur, and it may present as an open with weeping skin damage. It is typically shallow or superficial. Edges are irregular, diffuse, and you may also observe maceration or whitening of the skin. They are commonly found on the perineum, skin folds, between the buttocks and down the inner thighs. In your process of assessment, your patient may also report burning sensation, itching, and pain from the affected areas. Evidence relating to MASD classification is limited. There is the Ghent Global IAD categorization tool, which provides alphanumeric categories and subcategories to describe the extent of skin damage. And the tool was very specific to one type of MASD, which is the IAD category. UK practitioners suggested that this tool has similarity to the pressure ulcer classification system, and utilizing this for IAD classification may cause confusion when documenting the extent of skin damage. This confusion may become more apparent following the 2018 NHS improvement recommendations that clinicians should report MASD as well as pressure ulcers of category 2 and above. Now, the National Association of Tissue Viability Nurses in Scotland have developed a useful excoriation grading tool for IAD to help clinicians adopt a consistent and accurate approach in the assessment and management of patients with IAD. This classification tool or table that you can see on your screen now is an adaptation. It offers a simple categorization terminology regarding the extent of moisture damage using the term mild, moderate, or severe. And these also include a healthy skin category. Each category offers a clear definition as to what constitutes that level of damage and skin type. Okay, let's now focus on the treatment and prevention of IAD. The following precautions can help reduce the risk. Minimize skin exposure to urine and stool, manage incontinence, and for persistent cases, catheter or fecal containment devices may be needed. And consider strategies that will reduce friction forces. You can apply skin barrier creams and reduce friction forces to protect the skin from further damage. But please ensure that all patients with urinary and fecal incontinence should have their skin assessed at least once daily, depending on the number of incontinent episodes. And remember, change continence pads and products promptly when indicated, and include your patients in decisions about their care if it is appropriate. You must also consider a consistent regime of skincare to protect the integrity of the skin, including cleansing, moisturizing, and use of skin protectant, and avoid frequent cleansing with soap and water. Well done you! You have now completed the Wound Club online module on Incontinence-Associated Dermatitis. To check your knowledge and understanding, try and answer the following questions. Well done you! We have now completed this bite-sized module. Take the time to reflect on how you will take some of what you've learned and apply it into your daily practice. Please click on the link on the description below to go to the 15-minute version of this presentation. Once this is completed, you will have the opportunity to download CPD revalidation forms. Thank you for your time today. Please remember to look at other sections to access additional modules to help you on your learning journey.